Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Daintee Dietz. How are you this morning?
I'm great. How are you? Good.
And so far, so good. We're muddling through,
Good.
But as my mother would tell people, I woke up today, so it's going to be a good day.
Oh yeah, always positive.
Yeah, I laugh and tell people she's little Miss Mary Sunshine. It's almost disgusting, how happy that woman is. But we're going to talk about Medicare Made Simple because I have a lot of clients that are always concerned about, what they need and what the, thing is. So we're going to kind of dive into that today with you. And I appreciate you being on the show, letting us do this. So I think we want to talk first probably about, adult children definitely feel very overwhelmed with Medicare. And so they don't understand original Medicare, Medicare Advantage, Medicare, Medigap, all those things. And trust me, I was there 20 years ago. I know how confusing it is. And so,
Well, the biggest thing, and first of all, it's very important to have adult children or family involved with the beneficiary choosing what the selections are, because they're the ones that are going to have to navigate it ultimately. But traditional Medicare in a very simple form, the little red, white, and blue card, your A and B, you hear all these letters, it gets confusing. Don't worry about that initially. But those two things, A is your hospital, catastrophic, anything that happens in those four walls. Your B is your preventative care, shots, x-rays, MRIs, things like that. So that's the general. And those two together, you paid in, most people paid in their Medicare taxes. So that is for the most part covered. Part B does have a premium depending on income. We look at that separately. Those two together cover 80% of everything that Medicare allows. That's better than most regular health insurance available. Where I come in and where we need to, an experienced broker, the 20% that traditional Medicare does not cover does not have a cap or a limit. So a hospital bill, it's $200,000, which is very typical. You have the full 20% with just that A and B card. So we have got to, I think we'll talk about that in a little while, ways to kind of supplement that. Also, regular Medicare requires you to have drug coverage or you'll have penalties, whether or not you take prescriptions. We will address that later as well, because we do have to add that on. It does not come with that. So with the Advantage plans, I think you had asked about that. The Advantage plans, HMO, PPO style plans, kind of like we're used to with your company or private insurance. If those do nothing else, they kind of get a bad rap sometimes. And if looked at properly with your right doctors and drugs, it's no problem. But what they will accomplish first is that gap, that 20% that has no limit for regular Medicare, it will come and at least place a cap on that, a protection, a safety net, some kind of, so your costs don't exceed just a exorbitant amount. So its first role is to come in and put a cap on it. It will also come in and provide a little bit of that drug coverage that's required. Now, there's some limits to it as far as networks and, where you can go and who you can see. But we look at that in a different form. I think we're going to talk about that later. The GAP plans, supplements, they have different terms in the industry, but they're all the same. You either have that Advantage PPO HMO option to fill in that 20% partially, or you have a Medigap supplement that can fill it in 100%. Now, it's higher cost for that, but it can come in and fill in that 20% completely. So that's a great option, more expensive, but we look at both of those. I'll always address the two ways to fill in the gaps of Medicare, whether you're thinking one way or the other. I always present both and make sure that we have all that covered. Hopefully that gives you an overview for those.
it does, so thank you for that. So when helping a parent choose a plan, what are the must ask questions to make sure that the doctors and medications are actually covered?
Okay, I have a little intake form. We sit down. I like to do that in person if I can, get to meet the family and the person. each person is completely different. People listen to their cousin and their neighbor and their sister down the hall at the golf or whatever. And it is all personalized about you. So when I sit down with people, prescriptions and doctors are the number one things I'll look at, because that can drive the cost or the direction of which plans get weeded out that are not appropriate. Make sure we're in networks. Then we also talk about a wish list. People focus on all the extras they see on TV that a plan has. Well, it doesn't matter if your doctor and prescriptions aren't in it, but we always, want to try to find some extra features. But if there's any additional caregiving going on, do they have home health providers? Do they have special physical therapists they want to see? We really dig into those providers and the needs. Are they diabetic? Do they have heart conditions? Do they have this or that? Because there's different plans designated for those type of health conditions. So we really I let them tell me, who are you? What is going on? Who are your providers? And what are your needs? Kind of a wish list. And then I could go search for that with all the programs.
So cost seemed to be a big factor for a lot of clients. How much does it cost? So what kind of information do families need to know about premiums and those deductibles and those hidden out of cost expenses and things like that?
Well, when we collect the doctor and prescription data and kind of their little wish list, we put that in. I'm a broker, so I work with all the companies, or just about all the companies this year. I have access to all of the information. So I pull, it kind of will weed out initially what doctor doesn't take what. So then we start looking at those. Then we start to see the plans that are accepted by their physicians and pharmacies. Then what are the premiums for those? What are their deductibles? What are their copays? And then we start digging in. Okay, are those good? Do we still have a problem? Can we apply for extra help for prescriptions? Possibly Medicaid. There's pharmaceutical assistance outside of the plans that maybe Medicare doesn't provide. We can start seeing, if they start to see some red flags as far as the cost and copays. Hospitalization still has some pretty high copays for these, HMOs and PPOs that look attractive. So we've got indemnity plans. We've got other things that can start to fill in the gap. I don't want people to just have 15 insurance policies, unless it's absolutely necessary. But I have some that do frequent the hospital, can't qualify for the higher end supplement. So we do have to start finding some patches, but are good. I don't mean patch as it's not sufficient, but to start filling in. So we've got sources. When we start to see that, then we'll dig a little deeper into that.
And but what about parents with chronic illnesses or more serious healthcare needs? What should families be looking for when they're thinking about a Medicare plan, knowing that their parent is going to probably need a lot more medical assistance in the future?
It's very important. When we're first, whether they're turning 65 or retiring or whatever that age is, and they've got creditable coverage through the company or some other source, and we're taking that leap, or if they're already in it, I ask all of that, because at the time that you're leaving company or turning 65, you've got a special, enrollment process for the higher end supplement. Sometimes it's hard to justify an additional cost, but if we know that you currently have or history of cancer or heart or diabetes or something like that, it might be your only time to qualify for that higher end plan. So we would take that leap at that time. Or if you're in a plan and need to upgrade it because you have new existing conditions, you're probably not going to qualify for the higher end. So we've got there are plans designed that you will be eligible for chronic diabetes, for, kidney issues, heart issues. We would just adjust the type of plan. We have to get approval from the doctor verifying that you do in fact have those conditions, because there are some additional features to some of those plans. So we always just stay in communication. And if your needs change, I'm in touch, every few months with my clients, or as much as they want to call me. But if something changes, we can make adjustments. Yeah. And my phone rings probably when it shouldn't, and I answer it when I shouldn't, but I probably shouldn't say that, but it's true. They become family after a while. So.
I'm usually guilty of saying I answer emails in weird times. Don't assume that I'm always working at 6:30 in the morning or things like that. It's just, but so I can understand that. And so, how flexible is Medicare if health or financial circumstances change? How easy it is for families to switch plans because we don't want them necessarily locked in because I know if they need long-term care Medicaid, I don't want them on an Advantage plan and things like that. So how do we help clients navigate that?
Well, as it comes up, there are some exceptions that we can get throughout the year. If doctors come in and out of network, it's not automatic that they get a special enrollment if they have an Advantage plan. But the supplements are very flexible. You can make enrollments at any time of year as long as you qualify. So it really depends. They would have to let me know. I always ask for exceptions, whether it be through Social Security for issues with their Part B premiums, or with doctors' offices, or if they're moving. We even have weather-related exceptions. I thought we were going to have an exception because of the shutdown for the ACA and other Medicare, but we don't. But we always ask, and I very rarely have been told no. So always ask the question, and we'll try. If it's just because I want to, and you're in an Advantage plan, it's probably not going to happen. But most of the time, it's if there's a health change, you can get a qualification.
Perfect, because that's what families need to know. So, and are there programs or resources available to help aging parents save money on prescriptions, premiums, or other healthcare expenses? I asked that question, but I know the first thing my sister does was she shopped my mom's prescriptions between pharmacies. And so, and
No, that's a great point. When one of the questions in the beginning that I ask, and I don't want people locked into you only can go to these doctors or this place, but I know myself, I'm very spontaneous and flexible about everything but healthcare and certain other things. So I don't like to change my routine. A lot of people like their pharmacy at the grocery store because that's part of their daily process. You're right. I will run multiple pharmacies alongside their preferred pharmacies just in case, because I might see that XYZ is at Kroger versus HEB or Walgreens for, $2,000 less. Now, there are some caps that have been put in place, but if we see that, I'm going to bring that up to them, and I bet they're probably going to change or be aware of pharmacies. The same prescription at every pharmacy is a different cost. I have a lot to say about that, but it's not, that's the rule. That is the way it is right now. And so we have to pay attention, and we're watching all of that in that initial process. There's also, people can have a discount program, not necessarily through the manufacturers with the discount card. They have other grants. Sometimes I dig into the manufacturers and reach out to them to find out if there's any association that might help sponsor a person on a certain drug. GoodRx is always a great one. Now, when you go check out at the pharmacy, you can't use your insurance and GoodRx in the same transaction. You can use a prescription with a separate, transaction with GoodRx. There's a lot of things. I go over all of that, but yes. And there's also some state programs that we ask if they can qualify for that can help with premium assistance. There's a lot of tools. And I have a lot of resources, people like yourself and others that know some things that I may not. I know we share that information, but yes, you're not just doomed at what that program says when we sign you up. We always continue to look, and I put in the extra effort to make sure it's not all going to be zero and, no cost always, but there's times that we get surprised.
I'll tell you a funny real quick. And so both of my dogs are on medications. And my daughter was looking at one of them, and she goes, "Where are you getting this?" I'm like, "Man, I'm getting it, I think, from the vet. It's costing me $200 a month." She goes, "No, Mom, take the prescription with your GoodRx card to Kroger's. It literally cost me $15 a month. I went from 200 down to 15 with just my little GoodRx for both dogs, and I'm like, oh, that was nice, so yeah, I even shopped their other prescription because you can't get it through regular pharmacies, just because the cost is so high, for what you Yeah, it's like everything seems to be getting higher and higher these days.
Well,
So
and they change all of the time. Like I had we just finished traditional Medicare open enrollment or annual enrollment. And people are like, well, my plan was great, but my prescriptions were zero. And, that doesn't mean that's going to be the same. And that is a great point about pet prescriptions. My dogs are my kids. I'm very strict on the people I surround myself and their behaviors. However, my two dogs get away with murder. It's terrible. But so glad you brought that up. But yes, use it. Call your pharmacy and ask. And I've gotten them for my pets before or like some sort of an allergy thing or something like that. And it was like $8 versus $85. So
yes,
don't forget about that as well.
And so yeah, it was surprising to me. So, but I was really glad to know. So, yeah, definitely, always want to do a lot of shopping, and so my sister does it every year for my mom, and so
Well,
it's
we do
helpful.
that. We're welcome. So reach out. I mean, I want people involved, and I want people to understand what they have and look around and stuff. But we will help you with that. Like I said, a lot of people call an 800 number or this or that, and they talk to someone and that helped them. And that agent, whatever their contract is probably getting paid for that. You will never see or talk to them again. You'll never have someone to say, call, and we will help with that. I mean, I'm glad people are involved, but please, we are a resource that will help you with that kind of stuff.
Perfect. So here's the big question of the day now. If somebody wants to visit with you, Daintee, how do they find you?
Well, you can email me at daintee@shinebenefits.net. I believe it's on the screen, but I just want to make sure for those that are calling in or listening by phone, shinebenefits.net. Or you can call me at any time, text me, email. Everything rolls into my cell phone for the most part if I'm not at the office at 281-413-6614, or we can be found on Facebook and Instagram at Medicare Houston and LinkedIn. So we're all around. We try to be. So hopefully that helps. I appreciate you letting me come on today, Kim. It's been great.
Oh, honey, it's been great to see you. And you've got tons of information for our clients, and we look forward to having you on again soon.
Thank you.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.